notice someone who's struggling with their mental health. Maybe this is a colleague or a friend or family member. So maybe someone expressing hopelessness, maybe a change in those behaviors, someone withdrawing. It is absolutely okay and even encouraged that you approach them. Some of the things you can do in that moment is really just expressing compassion and empathy. So saying something like, hey, I noticed that you're not laughing as much as you used to, or, hey, I want to check in on you because you canceled on the last 3 events. So I think it's absolutely okay to draw attention to that and make it about your own observations. Not that like you seem angry or you seem upset, but hey, I'm worried about you. I have a thought that maybe something's going on. I think that when you're talking with someone who's expressing their concerns or opening up to you, to really listen and be as non-judgmental as possible. Also, not to provide all the answers right away, even if you have some great ideas about what they could do or some resources they could access. However, we also know that folks can struggle with suicidal thoughts. And I think that's a difficult place for a lot of people to be in, knowing how to support someone who is in that dire of a state. Our willingness to engage in those conversations can decrease the stigma around it. Most people who are experiencing suicidal thoughts experience a lot of shame around it, have a lot of resistance to letting people know that that's how bad things are, especially if they know that they would be leaving family or friends behind. So I think, again, to remember that you're there to support the person, not to solve the problem. And so some things you could do is make sure they know what the crisis hotline numbers are. 988, again, to let them know that there's a chat feature on the website if they're not willing to kind of talk on the phone. You can also accompany someone to an emergency room. If they're sort of don't have a thought of how to keep themselves safe or are really contemplating suicide, have a plan and a method picked out, I would say recommend that we go to the emergency room to get some professional help, or that they tell their doctor or therapist or psychiatrist immediately about what's going on. Being aware and supportive of our friends and our family can be life-changing. We can do a lot in our ability to support people just by asking questions, asking folks how they're doing, and being able to compassionately listen to folks' struggles.